Hi, my name is Ann Katona Lynn, and I'm here to just share a little overview of what comprehensive school mental health should look like and what the goals are for uh, Southern Columbia Area School District, as we have been doing a resource map and needs assessment to find out what are the needs of the community so that we can really support a much more effective and comprehensive school mental health program. And I have been consulting with the district and will help with training and technical assistance moving forward, but really wanted to do focus groups. And so we've been doing that with school staff as well as students. And now we're doing this I'm doing this short presentation as you are all going to be completing a short survey to give us your input so we can get as many people as possible from the community as well as families, and that we really have input to guide what we do moving forward. And so that's the goal. This is a short presentation that I hope will give you some insight into what comprehensive school-based mental health should look like. So these are all of the pieces. Typically we think of school mental health as providing counseling to individual students, and that is, yes, a piece of it, but we want it to be much bigger. And so some of the key pieces: making sure that staff are trained and that they know exactly what they need to do to identify kids that are struggling, as well as being able to provide supports in the school as quickly as possible, and also to prevent stigma, to make sure that the mental health stigma is that we're addressing that. Another piece is family, school, community collaboration and teaming. That's obviously why we are getting your input. We wanted to get your input to really hear what your thoughts are so that we can use that information to guide what we do moving forward, and making sure that we're connecting with outside mental health providers as needed to fill in any gaps within the district. The third one is a needs assessment and resource mapping, which I've been conducting really since last September. We've been doing needs assessment and focus groups. I've been doing with the groups, with school staff, as well as middle school and high school students, and with leadership in the district. And really, obviously everything that's happened with COVID, we were hoping to do more focus groups with the community and family, but we figured we would get as many as possible through doing this survey, and also just to give you this little presentation so that you have an idea. But this information that we're gathering is really going to guide. We're going to develop a strategic plan over the summer so that we can really hit the fall with a good plan in place, ready to go moving forward. Number 4 is a multi-tiered system of support, and I'll talk about that a little bit. Number 5 is mental health screening, where we're looking at kids, at all children, and identifying who are the kids that are really needing additional support, and making sure we're not just waiting until they're struggling or till there's a crisis. So we want to really focus on prevention. Using evidence-based programs and emerging best practices. All of these key components came from a national report and a collaboration of a lot of national experts on school mental health, and making sure that we're doing things that we know work and not just things that sound good, things that are going to have the impact that we want to have the impact. Data is key, because we want to make sure we actually are having an impact. We don't want to just say, yes, we think it is. We want to make sure we can validate that and we know for sure that that's what's happening. And then funding, and a big piece of it is that Southern was awarded a PCCD grant, and this funding is all supporting this kind of comprehensive school mental health. So this is all grant funded. And I am supporting the school district in helping to develop this plan, as well as we'll be providing training and professional development. So when we think about kids, we see that they're really, they are within their own individual kind of sphere, but we have to think about their needs on a larger scale, so that it's how are the environments around them supporting them, because they all have an impact. It's a ripple effect, again, and obviously with everything that's happened with COVID, and with the civil unrest that's going on in the country right now, there are, you can see how these things all impact each other. So we just want to make sure that we're looking at all aspects of supporting the children and youth in Southern Columbia School District. This is a visual for a multi-tier system of support. And really what this means, it's around doing things for all kids so that we're really promoting positive social-emotional behavioral skills and overall wellness for all students, and not just students, but families and for staff. Because we know is that when adults are stressed out, they're not able to really support the children. So we want to make sure that those foundational elements are there. And this professional development and these school community partnerships are a huge foundation for supporting all of this. The second tier is when we've done things here and we still have kids that are struggling. We do more group interventions so that we can provide support sooner rather than automatically putting them with intensive needs. If we can do things in more of a group format, then we're going to have a bigger bang for our buck, and it's a lot more efficient with being able to use staff that already exists within the school district. And then tier 3 it's that targeted support for the more serious concerns, and that we want to make sure that we're getting those kids the needs that have those needs, the supports that they need as soon as possible. And so the key is that all 3 of these tiers are all connected. It's not an isolation. We want to break down silos within the school, within the district, and even within the community to make sure that all of the services and supports are really functioning as effectively and efficiently as they can. And this multi-tiered model really is the way to do that. This is just an example of how community partners and school districts really play a key role in school mental health. So as you can see, the school district, the majority of kids are going to be, or the majority of kids are going to be getting the support at tier 1 through the district. And so it's kind of an inverted triangle. Usually red is for the more intensive, but what we see is that the universal supports, that the majority of kids are going to be getting those supports from, this is their #1 priority. And then the school district, that tier 2 would be the next priority, and tier 3 are, their priority in terms of who would be providing services, whereas the community partners would be kind of the complementary, being able to provide more services for those kids that are needing tier 3 support, and then maybe some support for kids that are getting group. But also we want to connect them to those things that are done universally throughout the district, so that again, we're making sure we are not missing any gaps in any of the services and supports for kids. Some of the outcomes, just to kind of show, what we know is that when we do a comprehensive school mental health program and system, it really, we see improvement in academic outcomes. So it's not just kids' mental health and well-being, it's also improves their outcomes. Because if you think about it, if you're really stressed, it's going to be much more difficult for you to focus on learning. And so we have to think about all of those things. Children are whole children. They're not isolated. They're not academics over here, or behavior over here, or mental health over here, and family over here. They are a whole person. So we have to kind of consider that. Making sure kids do have access to care. And the more that they have access to care in school, there's less stigma, and it's easier access, so parents don't have to travel, and it provides a much better, we know that it provides a much better outcome for kids actually, getting services. Making sure we're identifying kids early rather than waiting till much later, and intervening early. It helps with creating a positive school climate, and also that safety piece. So again, finding kids that are at risk or of really struggling, finding them sooner than later. Youth, family, educator, and peer engagement. We see a much better engagement, and we really want to do a lot around youth engagement. So getting the youth voice to be a part of this, because they know what, what's going on with their peers. And so we want to make sure that we're engaging them as much as possible. The continuum of services is really that it's for all kids, all the way up to those kids that are needing much more intensive support. So that it's everything, it's on that continuum. So it's a full view of what we want to do for school mental health that's all connected. And then better psychosocial outcomes. So these are some of the key things that we could potentially see. So these are the questions that are going to be part of the survey that you're completing. And so again, we really appreciate you completing this. And if you could just thoughtfully look at these questions on the survey and just let us know what your thoughts are and be honest about it. This is an anonymous survey, so that we could truly use this information to then guide what we do moving forward. So thank you very much. And if you have any questions, we will make sure that you have my email so that we can respond to any questions that you have with your survey. So thank you very much.